Alcoholism is an age-old malady that causes serious health, social, legal, work, and family problems for individuals, families, communities, and society as a whole. Yet as serious as alcoholism is, there's still debate about whether it's a disease or not.
Now is always the time to start making positive changes in your life.
Dr. Donna, Leigh, Bliss here. On this channel, I promote optimal mental health and well-being to help you become the best version of yourself. In today's video, we're going to explore the question, is alcoholism a disease, or is it really more of a personal failing? So let's get started. So the actual definition of a disease is an identifiable structure or function that has a known cause and a distinctive group of symptoms, signs, or anatomical changes, such as like a brain tumor. Yet there are some conditions, such as schizophrenia, that don't really match up with this definition, but most people would think it's really a disease. So if we use this definition of a disease, it becomes murky whether alcoholism is actually a disease or not. Is it a condition? Is there some observable aspect of alcoholism in the brain, for example, that we can identify? Is it a result of some anatomical changes? Certainly, alcoholism causes organ damage, but it isn't necessarily something that we can locate in the body. We also know that while there's common signs and symptoms of alcoholism, it doesn't progress the same way for everybody. Some people can start drinking alcoholically from the get-go, and others may be social drinkers for years, decades, before they cross the line into alcoholism. So one of the principal aspects of alcoholism that make it difficult to really identify it as a disease, I think, has to do with the course of, in this case, the disease of alcoholism is not necessarily uniform, and it varies so much that it's a little bit confusing about whether it's a disease state or not. So etiology is the study of what causes something. And because there's so much controversy about what causes alcoholism, there are different etiological models that are used to explain the malady. The most common one is the moral model. It basically says alcoholism is the result of somebody having bad character. They're a bad person. They're immoral. They're irresponsible. They're impulsive. When you look at somebody who's in active alcoholism, they frequently behave that way. So the moral model actually makes a lot of sense. The next model is the symptom of a psychiatric problem. This holds that alcoholism really isn't a problem in and of itself. It's a symptom of some underlying psychiatric issue, such as low self-esteem or anxiety. And so this model basically holds that people drink because they're having difficulty coping with these other issues, and that once we deal with these other issues, they won't drink anymore. Another model is the addictive personality. This one is very common. I work with many people with problems with alcohol, and they'll tell me they have an addictive personality. And when I ask them to describe that, they say, well, I can be irresponsible, I can be antisocial, I can be impulsive, and that's the reason why I'm an alcoholic. And I say, well, that's interesting, but have you ever met people that have those same characteristics, but they don't have a problem with alcohol? And they smile at me and they realize that alcoholism isn't caused by these personality characteristics. These characteristics tend to be pretty common, though, in people that have an alcohol problem. Another model is the cognitive behavioral model. And it basically, in a nutshell, is saying that alcoholism is caused by irrational, distorted thinking and beliefs that we have, and that we act on those beliefs, and they can drive us to drink alcohol when rationally it would not be the right thing to do. The final model is the disease model. And this model basically holds that alcoholism is a disease Many people believe that there's a genetic predisposition to it, but it really holds there's something different about somebody who's an alcoholic, that for whatever reason, once they start drinking, it sets into motion a craving for more, and they lose their ability to control drinking. And so the disease model is very persuasive too. So how we see a problem has implications for how we think we should deal with it. And so when we look at these various etiological models, the cause of it helps determine what we think is the solution. So the moral model, which holds that alcoholism is caused by an immoral character, we basically exhort the person to be a better person, maybe go to church, be more responsible, clean up their act. And the idea is if they become a better person, they'll stop drinking. The problem with that approach is that it doesn't work because it confuses, the effects of alcohol with causes. And so there's many people that are immoral, irresponsible, and aggressive, and they don't have a problem with alcohol. Also, many people who are alcoholics behave quite responsibly when they're not drinking. So the moral model really isn't useful from a treatment point of view, and what it really does is cause shame. And shame causes more drinking, and unfortunately, people that feel very shameful about their drinking tend to be resistant to come into treatment and get help, which causes even more drinking, so it becomes a vicious cycle. The symptom of a psychiatric problem is problematic because one of the things we've learned for people that cross the line into alcoholism, that maybe low self-esteem or anxiety cause them to first start drinking for relief from those feelings. But once they cross the line into alcoholism, the alcoholism takes on a life of its own. And so nobody's continuing to drink just because of low self-esteem. So alcoholism becomes a primary disorder that needs to be treated in and of itself. So this model, though, is informative because it says from a treatment point of view, if somebody started drinking because of a trauma background or they had depressive symptoms, that those issues are going to need to be addressed if there's any hope for them to stay sober. But it's really clear that their drinking isn't just a symptom of those symptoms. And if you're able to take care of those issues, help them have high self-esteem, they'll automatically stop drinking. My experience has been people, once they cross the line into alcoholism, really lose the ability to control their drinking. And it's virtually impossible to repair their self-esteem or help them to address anxiety. So the symptom of a psychiatric problem model isn't very useful from a treatment point of view either. The addictive personality model isn't useful at all because the characteristics of that model are pretty broad, and there's so many people that have those characteristics that don't have a problem with alcohol at all. The problem with the addictive personality model is it's kind of similar to the moral model. It basically is saying you're not behaving well, and if you would be a better person, you would stop drinking. And of course, that approach doesn't work. The cognitive behavioral model is actually a useful one because it looks at the role of distorted thinkings and beliefs and behaviors alcoholics engage in that help maintain the alcoholism. So from a treatment point of view, cognitive behavioral therapy is incredibly effective in treating alcoholism. And it really looks at the role of distorted thinking, such as the thought that a drink will make somebody feel better, even though drinking is causing them problems, or the belief that somebody can control their drinking, even though their background shows they're not able to. So I really like this model quite a bit in working with people because it lends itself to developing interventions that can help people get sober. And finally, the disease model. Even though I think from a strict point of view of what a disease is, the notion of alcoholism doesn't match up 100%. My perspective as a clinician with over 30 years of experience is that I don't really care if alcoholism is a disease or not. I don't really get into the debate of it. I look at it from the standpoint of a clinical point of view. The disease model calls on us as clinicians to treat people holistically, mind, body, spirit. And so when we treat people holistically, we help them to rehabilitate. The disease model helps to neutralize shame. So when we work with people, we talk about the fact that your drinking has caused you to behave badly doesn't mean you're a bad person. You may have done bad things, but that doesn't mean you're immoral. And so the reduction of shame makes it much, much easier for people to enter the treatment process. Now, one of the issues that a lot of times people have with the disease model is they'll say, well, that's really not fair. Now the person can just go around saying, well, I have a disease, it's not my fault. And that really misses the point. From a treatment point of view, obviously, if somebody has a disease, they're not responsible for creating it. Somebody who has heart disease isn't necessarily responsible for creating it. Maybe if they weighed too much or they didn't exercise enough, that may have contributed to it, but we're not going to blame somebody for it. So one of the key tenets of recovery from the disease model perspective is while we'll tell people that you're not responsible for your alcoholism, you are responsible for your recovery. And that means any things that you may have done that were illegal, unethical, or immoral when you're drinking, you're responsible for addressing in recovery. And so I think that approach of helping somebody find redemption to feel better about themselves despite the wreckage of their drinking makes the disease model incredibly useful from a treatment point of view. So just from that point alone, I support the notion of a disease model. It is functional, it is hopeful, it helps people get the help they need, and I've seen when that model is applied from a treatment point of view, I've seen it work for many, many, many people. So to answer the question, is alcoholism a disease? You betcha. So we're now left with the notion of where do you get help? Perhaps you have a problem with alcohol, or you know somebody who does and you don't know what to do. The good news is there's plenty of resources available that can help you. Findtreatment.gov is a wonderful resource that helps you locate, based on the state you're in, the many different kinds of treatment programs, inpatient, outpatient, detox programs for substance abuse and mental health issues. So I encourage you to check that out and then check out any of the particular treatment programs. I'm a strong proponent of treatment. I've seen many, many people get on a path of recovery and have long-term sobriety because they got involved in treatment. I've been sober over 40 years, and I started off on my path of recovery by going into treatment. It was a godsend for me, and so I strongly encourage you to check that out. Another wonderful resource is Alcoholics Anonymous. It is the 12-step program that started back in the 1930s when alcoholism was seen as hopeless and when the moral model was predominant. And Alcoholics Anonymous was really quite unique in that it saw alcoholism as a disease. It looked at a mental obsession and a sort of physical allergy to alcohol. So it was ahead of its time. And the nice thing about Alcoholics Anonymous is that it relies on others helping others. And it has a pretty long track record of helping people find long-term sobriety. I have many clients that have used Alcoholics Anonymous to great success, and so I encourage you to check out the website. One of the most important aspects of AA is that by seeing it as a disease, it basically has the position that you have to be 100% abstinent, that you can't safely drink alcohol, that once you introduce any alcohol into your system, it triggers the craving that leads to more. And so AA has a spiritually based program that is really quite holistic, that is about helping somebody become more responsible, live up to their potential, and despite how damaging their drinking may have been, to really become the best version of themselves. I encourage you to check it out. Thank you for watching this video. I hope you found it helpful. Please click on the subscribe button so you'll be notified when I release new videos that promote optimal mental health and well-being. I've included links for other videos you might find helpful. If there are other topics that you would like me to do videos on, please let me know in the comments section. Finally, remember, now is always the time to start taking positive action in your life. I'll see you next time.